Currently in upper extremity rehabilitation, all therapeutic tools in the active assistive phase of motion recovery require the patient to perform an active grip. The UE Ranger, in contrast, supports an open hand. To demonstrate why this matters, I'd like to ask you to try this on your own such that you can feel this in your own body. So first of all, I'd like to ask you to make a grip. Not a real strong grip, but just a moderate grip with one of your hands. And then what I want to ask you to do is to elevate your arm and just recognize, observe the effort that it takes for you to elevate your arm. And also stop where you feel like you're working a little harder to elevate your arm. And then now try that with an open hand. And often, more times than not, a person will be able to go higher with their hand open versus in a grip. And the response to the body with a grip are three things that I've observed. One is when a person has an impaired shoulder, the active gripping requires that impaired shoulder to contract just like it normally would for proximal stabilization. But if the rotator cuff is weak or overpowered by the dominant muscles such as the deltoid or the upper trap, then they're going to perpetuate in their role. And so you're only promoting the compensation, the substitution. The second thing is a grip is a form of protection. It's a startle response. And so a person who's been in pain in performing a grip is going to be inclined to brace in other places. And the third thing is that when you make a grip, you're essentially producing a co-contraction of the wrist and the finger muscles. And so when you make that co-contraction, you're essentially working against your own co-contraction, which is difficult to do. And we do that with acts of life, like lifting up a jug of milk, but that is ideally when the shoulder system is intact and strong and has good endurance, not when we're trying to change the order of movement health. So with traditional methods we prescribe for our patients, the golf club, a cane, a broom handle, all those require an active gripping. So if you're asking your patient to elevate with a grip, you're just promoting those substitution requirements. But with the UE Ranger, an open hand, the person has the capacity, similarly to the rigid bar, except the articulation of the UE Ranger. So as they go up, that forearm and wrist have the freedom to just follow the natural motion of the full joint system. In a hook-lying position, the UE Ranger supports the opportunity to produce variable applications of both motion recovery as well as neuromuscular recovery. So a person can work on a vertical position and then trying to just work on the force couple, the articulation isolated to the shoulder, as well as bringing on various supportive muscle activities such as the triceps and supporting the elbow and the shoulder. And then finally integrating those motions into multiple planes of elevation.
We invite you to visit our website at ueranger.com, where you can find further resources to support using the UE Ranger with your patients. You'll be able to download a clinical manual and home exercise program, as well as view the supporting research and testimonials of both professionals and patients. We'd be happy to answer any questions you might have or discuss in more detail the features of the UE Ranger Movement Health System. Please call us at 402-210-8406 or email us at rehabinnovations@cox.net. We look forward to showing you how powerful the UE Ranger can be for your patients and your practice.